Hello friends and welcome to my channel. I'm Dr. Mohsen Raj. I've done my MD in pediatrics from Aiims New Delhi. I had All India rank 17 in the Aiims PG entrance 2017 and All India rank 11 in the PGI Chandigarh entrance. I subsequently had All India rank 1 in the DM cardiology entrance exams of Aiims NEET as well as PGI, and I'm doing DM cardiology at Aiims New Delhi. In this video, I will talk about some of the key differences between Aiims and PGI, because some of you who have qualified and ICT will be deciding, which out of these two institutes should you prefer. Well, right at the start, I tell you that whichever one you choose, at the end of the 3 years, you'll be a well-trained MD or MS resident, because both of these institutes are actually the best medical institutes and the best places to do your MD or MS from. So if you're getting one out of the two, great. I mean, people are not that lucky to be, in these two institutes of this country. So if you have the option, you're in a good place. So you can choose any one of the two. But I'll highlight some of the key differences that you should keep in mind before you actually go ahead and choose either Aiims or PGI Chandigarh. So let's get started. तो सबसे पहले बात करते हैं exposure का, because the most important thing in MD/MS is the exposure itself. So Aiims as well as PGI, you will be exposed to all the subspecialties in a particular specialty that you choose. If you're doing MD in medicine or pediatrics, or if you're doing MS in general surgery, so you'll be exposed to all the subspecialties. So that is an advantage. You'll be well trained in all the subspecialties of medicine or pediatrics or surgery, whichever one you choose. So for example, take pediatrics as an example. So in pediatrics, you'll be trained in all the subspecialties. You'll be trained in pediatric ICUs, neonatal ICUs, in all different areas like nephrology, pediatric neurology, pediatric endocrinology. So by and large, at the end of the 3 years, you will be a well-trained pediatric resident. Some places, some areas will be better in one institute. For example, maybe pediatric endocrinology or pediatric gastroenterology may be better at PGI. On the other hand, things like neonatology or maybe pediatric neurology, pediatric nephrology will be better in Aiims. But by and large, taking everything into consideration in terms of exposure, in terms of your training as an MD resident, both places are like almost neck to neck. They're almost similar. But a few things that you should remember at the in this exposure thing is that PGI gives you things in bulk. You'll be given lots and lots of cases. So in a way, in terms of training, especially procedural skills, maybe you may be better trained in PGI Chandigarh, but having too many cases, too much of work, it overburdens you. That's the side effect at PGI Chandigarh. So as I mentioned that, exposure-wise, both are excellent, but the bulk or how hectic your duty is going to be, that's where the things take a twist. PGI in Chandigarh, your duty hours will be much more than Aiims. The number of patients you see, the amount of work as a resident you do will be much higher at PGI Chandigarh. So physically, emotionally, mentally, you'll be more overburdened at PGI Chandigarh than Aiims. Aiims, of course, there's a lot of work. Of course, your duty hours will still be hectic, but not as hectic as PGI Chandigarh. So take this in, right at the start, take this in your mind that if you join PGI Chandigarh, you may have to, perform your duties in a very inhuman way, working 36 hours in a stretch or something like that. Or, you may not get time even for yourself, even for your personal physical health, for example. But at Aiims, no doubt, duties will be hectic, but they will not be as hectic. You will get time for your physical health, even for your family, or even for your studies for that matter. Well, next important difference is, of course, the fact that PGI is in Chandigarh and Aiims is in Delhi. So whichever you like, you want to stay in Delhi or you want to stay in Chandigarh. So I personally prefer Delhi, so I'll better prefer Aiims for that purpose. And also the hostel life. I think Aims hostels, I visited PGI Chandigarh as well. I believe that hostel life at Aims is way better. The campus is way better than the PGI campus. So the city choice, the hostel, that life is also better at Aims. So basically what I wanted to share with you is that whatever your branch of choice, if I am at your place, I'll prefer to join Aims instead of PGI. The simple reason being, number one, that you'll get a similar exposure in both the places, but the working hours, the nature of the work, the overall, the environment at PGI is supposedly a little bit more toxic than Aims, or the working hours there are not, they don't suit me, or they won't suit either you most probably. So I'll prefer to join Aims, and that's why I did, and that's what I think you should also do, because nobody wants to work in a toxic environment where the working hours are beyond 36-hour duration. You may not get time even for your own physical health related things. So if you're given a choice, you have a branch of your choice at both these places, preferably choose Aims. But if you're not able to choose Aims, maybe you're getting only PGI, then that's also okay. You will go through these 3 years. Your training will be more rigorous, but definitely in terms of certain things as procedural things, you'll be far more superior than any other resident. So I once again congratulate you that you're qualified Inicet. You are about to join maybe one out of the two top institutes of this country, and you will be one of the better MD or MS residents after 3 years, and then on a journey to your DM or MCH in your future. If you like the contents of this channel, I would appreciate if you like and subscribe to this channel. Thank you.